In a hospital, a meal is never just a meal. It arrives at a moment when a patient may be anxious, uncomfortable, or far from home. The quality of the food matters, but so do the accuracy of the tray, the warmth of the interaction, the confidence of the person delivering it, and the team's ability to respond when something is not right. That is why hospital food service can have a meaningful influence on the overall patient experience, and it is why improving patient satisfaction requires more than changing a menu. It requires a connected operating model, one that brings together purpose, process, and people. Across 8 Florida hospitals, TouchPoint Support Services put that model into action. In one fiscal year, the market improved its overall net food score by 9.7 points, increased its food service staff interaction score by 8 points, and reduced taste-related complaints by 16%. The results show what is possible when hospitality is supported by clear standards, accountable leadership, and engaged associates. Delivering a positive patient dining experience in one hospital is demanding. Doing it consistently across 8 hospitals adds another layer of complexity. Every day, food and nutrition services teams must coordinate clinical diet requirements, food quality, tray accuracy, presentation, timing, patient communication, and service recovery, often while patient volumes and operational demands are changing. An isolated improvement may lift performance for a short time, but lasting gains require a repeatable system. TouchPoint and hospital leaders recognized an opportunity to strengthen consistency across the Florida market by connecting day-to-day operating practices directly to patient feedback. The goal was not simply to serve better meals. It was to create a more reliable, hospitality-driven experience at every stage of the patient journey, from preparation and plating to bedside service, rounding, and issue resolution. TouchPoint established a standardized, market-wide quality framework designed to identify opportunities early and help leaders act on them quickly. Each hospital used monthly action plans with measurable objectives tied to patient satisfaction results. Subject matter experts reviewed progress, studied recurring feedback, and helped translate insights into specific improvement priorities. The framework included test tray audits, tray accuracy audits, patient rounding, monthly performance reviews, Qualtrics comment analysis, and continuous improvement tracking. More than 3,200 patient surveys collected during the fiscal year gave teams a substantial base of feedback to understand what patients valued, where the experience was falling short, and whether changes were working. This was an important shift. Measurement was not treated as a report card reviewed after the fact. It became a management tool. Leaders could connect operational activities with changes in satisfaction scores, reinforce successful practices, and adjust initiatives that were not producing the intended result. That combination of standardization and local visibility created greater consistency across all 8 hospitals while allowing each team to respond to the needs of its patients. With the operating framework in place, teams focused on the details patients could see, taste, and feel. TouchPoint reset plate presentation standards, retrained associates on meal presentation, strengthened recipe compliance, and expanded bedside ordering initiatives. Patient rounding increased, room service workflows improved, and teams placed greater emphasis on real-time service recovery. The market also used taste plate presentations to engage nursing partners and build shared understanding around the patient meal experience. This cross-functional collaboration mattered because hospital food service does not operate in isolation. A strong experience depends on coordination among culinary teams, patient service associates, nursing, and hospital leadership. One especially practical innovation was the patient server timeout log. It empowered associates to pause service whenever a meal did not meet established quality standards. Instead of allowing an issue to reach the bedside, the team could correct it first. The process was simple, but the message was powerful. Every associate had both the authority and the responsibility to protect the patient experience. Operational discipline created the structure for improvement. culture gave that structure life. Florida leaders invested in meaningful associate engagement, servant leadership, coaching, one-on-one development, recognition, continuous communication, and cross-functional teamwork. The objective was to create an environment where associates understood the standards, felt supported in meeting them, and saw how their work affected patients. That sense of ownership showed up in stronger patient interactions and more consistent execution. Associates were not simply completing a task or delivering a tray. They were contributing to a moment of care, and they had the tools, expectations, and leadership support to make that moment better. Within one fiscal year, the Florida market delivered measurable gains across multiple indicators of the patient dining experience. The overall net food score improved 9.7 points, moving from negative 0.9 to positive 8.8. In Florida East, the net food score rose 12.9 points, from 2.0 to 14.9. The food service staff interaction score increased by 8 points, demonstrating that patients noticed not only changes in the meal, but also changes in the human experience surrounding it. The percentage of patients who said their food met expectations increased from 57% to 61%. Taste-related complaints declined by 16%. And more than 3,200 patient surveys helped validate that the improvement was broad enough to be seen across the market, not limited to a single hospital, team, or short-term initiative. Together, these results reinforce a central lesson. Patient satisfaction improves when operational performance and associate engagement advance together. Better processes support better service. Better supported associates create better interactions, and better visibility helps leaders sustain both. For healthcare leaders, the value of this case study extends beyond the individual results. The Florida market established a scalable framework that can be applied across a complex health system while preserving the ability to respond locally. The model begins with consistent standards. It uses real-time patient feedback to reveal opportunities. It gives leaders defined objectives and a regular accountability rhythm. It equips associates to stop problems before they reach patients. And it invests in the coaching, communication, and recognition needed to make improvement part of the culture. This approach moves hospital food and nutrition services beyond a collection of daily transactions. It positions support services as a strategic contributor to patient satisfaction, operational consistency, and the broader healthcare experience. Most importantly, it creates a system for continuous improvement. The work does not end when a score rises. Teams keep listening, measuring, learning, and refining the experience. Health systems are under pressure to improve patient experience while managing workforce challenges, operational complexity, and financial constraints. In that environment, fragmented initiatives are difficult to sustain. Healthcare organizations need a partner that can connect strategy with execution across every facility. TouchPoint brings healthcare-specific food and nutrition services expertise together with standardized operating practices, hospitality-driven training, performance visibility, and the people-first leadership model. The objective is not to impose a one-size-fits-all solution. It is to establish a strong, repeatable foundation and then use local insight to improve the experience where it matters most. The Florida results demonstrate how that partnership can translate into measurable progress. Stronger satisfaction scores, fewer taste complaints, better staff interactions, and a more consistent patient dining experience across multiple hospitals. Exceptional patient experiences begin with support services designed around the people they serve. If your health system is looking to strengthen hospital food service, improve patient satisfaction, and create greater consistency across locations, TouchPoint Support Services can help. Our healthcare experts work with leaders to build hospitality-driven food and nutrition services solutions that connect people, process, and performance. Visit TouchPointSupportServices.com to explore what a more consistent, patient-centered dining experience could look like across your organization, and start a conversation with our team today.